Hi, I'm Noah Lewis, Executive Director of Transcend Legal. In this video, we're going to address some of the questions we received in response to our survey about getting trans care covered under insurance. One common question was about how to get insurance. If you don't have insurance, you'll want to participate in open enrollment and buy a plan through the marketplace. If you cannot afford the premiums, financial assistance is available, or you may be eligible for Medicaid. Open enrollment is only from November 1st through December 15th this year. This is much shorter than last year when it extended through January 31st. So now is the time to locate a navigator who can help you get coverage. The vast majority of marketplace plans have removed their discriminatory trans exclusions. You can visit Out to Enroll's website to see what information they have compiled about trans coverage in marketplace plans. They can also help you find a trans-friendly navigator in your area. And if you do end up with a plan with an exclusion, that is still something that you can challenge.
Hi, I'm Charlie Arrowwood, an attorney at Transcend Legal. We've received a lot of questions about how to find a trans-friendly provider. There might not be any providers in your area who have experience treating trans people, or the ones that do don't take your insurance. In the latter case, you can submit a request to your insurance company to ask that the provider be considered in-network. You'll need to describe why you need specialized treatment and that there are no qualified providers in-network. Ideally, your primary care provider can assist you with this. Your best bet for finding a trans-friendly provider is to ask other trans people in your area. Connecting with other trans people locally will provide you with information you might not otherwise be able to find. Getting together and organizing as trans people will also be the best way to move forward to create trans-friendly providers in your area. There are several web-based projects aimed at sharing information on trans-friendly providers. There are websites such as Rad Remedy, MyTransHealth, TransPulse, and OutCare. The GLMA and LGBT Medical Association also has a provider directory. There are also surgery results sharing sites such as TransBucket. Such websites can only be a starting point. We can't comment on the accuracy of any of the listings. You should always do your own investigation and make sure you're comfortable with the qualifications of the provider you choose.
We all know that trans people shouldn't have to educate their doctor on how to treat trans people. But what's the reality? The reality is that there are not currently enough doctors who have experience treating trans people. Until recently, trans care wasn't taught in medical school, though that is starting to change. Many doctors who are unfamiliar with trans care can think it's a lot more complex than it really is. Doctors may also not know how to properly address trans people or how to refer respectfully to body parts. Educating providers isn't going to be for everyone. But if you're in an area without any experienced providers, or there are long waiting lists for the trans-friendly providers, this may be your best option. If you already have a primary care doctor, consider asking them to provide your hormone therapy. Hormones don't need to be provided by an endocrinologist, and many family doctors routinely initiate and monitor hormone therapy for trans people. If your provider doesn't have experience with administering hormones, there are many protocols that they can easily obtain, such as those from Cal and Lord in New York City, or Fenway Health in Boston. The Center of Excellence for Transgender Health in San Francisco has a comprehensive online guide to primary care for trans people that also includes hormone protocols. So this information is readily available. It's more about getting doctors to feel comfortable using it. Thankfully, there's a service called TransLine. TransLine is a national online transgender medical consultation service. Your provider can connect with a doctor who's experienced with providing trans care and get answers to any questions they have. In 2006, I moved to Connecticut for a new job, and I needed to find new providers. I couldn't find any trans experienced providers, so I called to schedule an appointment with the local gynecologist, and I showed up on the appointed day. They tried to tell me I was in the wrong office and that I was looking for the family practitioner down the hall. I assured them that I was in the right place and that I had an appointment. They must have thought it was a prank call when I set up the appointment because they had no record of it. Although I said that I was transgender, there was still a great deal of confusion, and several other staff members came over to try to sort things out. They were all talking amongst themselves and not paying attention to me. Eventually I said, "I have a vagina!" and this seemed to snap them out of their confusion. They agreed to get the doctor and have him meet with me in his office. He explained that he had never worked with a transgender patient. His first question was to ask me when I'd had the surgery. He thought that I was a transgender woman who'd undergone vaginoplasty. Once I explained that I was born with it, He seemed to realize this was something he could handle. He fit me in that day, and it was fine. I know that I have a lot of privilege, and that enabled me to stand up for myself. But plenty of other trans people also have that privilege. Those of us who can owe it to ourselves and the rest of the community to help create the trans-friendly providers that we all so desperately need. When I moved back to Pittsburgh the following year, I didn't have insurance, so I went to a public health clinic. To my amazement, it was one of the most respectful trans-friendly experiences I ever had. Those folks had clearly been trained, and I was the beneficiary of some other person's efforts to educate them. The reason I didn't have insurance at that time relates to another common question that people had. I had applied for an individual plan, but was denied because at that time, being trans was considered to be a pre-existing condition. I couldn't even buy an insurance plan. Thankfully, that is no longer the case, and the concept of pre-existing conditions no longer has any relevance. The Affordable Care Act prohibits coverage denials based on pre-existing conditions, and this seems to be the one provision that is not going to be rolled back.
A lot of people have expressed their fears around trying to get trans care covered under insurance. People have asked if they can safely ask about trans care without being discriminated against or having their premiums increase. People fear their policy will be canceled. Then there's the general fear and anxiety of possibly being denied coverage or having to discuss your trans status with people who may be clueless or worse. Under the Affordable Care Act, the Americans with Disabilities Act, and oftentimes state law as well, it's unlawful to discriminate against people based on transgender status. That means that your insurance company cannot raise your premiums or cancel your policy simply because you're transgender or you ask about transgender care. You're paying a premium, and it's your right to know what that premium gets you. It's also against the law for an employer to discriminate against an employee because of their sex or disability. So if you have a self-funded plan, and your employer treats you differently after you ask about trans care, that may be unlawful discrimination. While there's no way to know how your provider, insurer, or employer will respond when you bring up needing trans care, the first step is to ask. As Noah mentioned, if you're in a position to be first to ask, your community needs you to do that. If your provider responds unfavorably, that's important for other local trans people to know. You also have many options in terms of reporting the discrimination to the appropriate authorities. And if it was particularly egregious, you could even pursue a lawsuit to ensure that it doesn't happen to anyone else. We have resources on our website on how to respond to medical provider discrimination.
The only major concern you should have about asking the insurance company about your coverage is if your plan has an explicit exclusion and you are receiving treatment under a diagnosis code that is not gender dysphoria. It's always best to have your provider use the diagnosis code for gender dysphoria, particularly if the procedure at issue is surgery, so that you can know for sure whether it's going to be covered or denied for that diagnosis. I once worked on a case where a trans man had a hysterectomy for pelvic pain. It had been pre-authorized under that diagnosis, but once it came time to pay the claim, they denied it because the plan had an explicit exclusion for gender reassignment, and they claimed the surgery was really to treat gender dysphoria. He then received a huge bill for surgery. That's not a situation you want to find yourself in. Even if a claim has already been paid, the insurance company can demand payment if they find evidence that the claim was fraudulent. Make sure your provider is using the diagnosis code for gender dysphoria, F64. We understand that it can be nerve-wracking to call an insurance company or provider and ask for help in getting the coverage that you need. Insurance companies don't want you to assert your rights, and trans people have been told over and over that our healthcare isn't worthy of insurance coverage. It's normal to feel afraid, but you don't have to let that fear paralyze you. When you're psyching yourself up to make an appointment or call an insurance company, try telling yourself, I won't participate in my own oppression. It's one thing for others to try to deny us care, but that doesn't mean we have to go along with it and not even ask. As one of our clients said recently, my face, my fight. Thanks for watching our series. We hope that you are well on your way to getting the coverage that you need or are prepared to enlist legal assistance if you need it. Please help spread the word about these videos so that no trans person has to go without the healthcare that they need. If you have other questions that haven't been answered, leave them below or reach out to us through the contact form on our website, transcendlegal.org.